Hello, my name is Dr. MarkAlain Dery. I'm the Medical Director of Infectious Diseases and Chief Innovation Officer for Access South Louisiana, the largest Medicaid providing clinic system in Louisiana, and co-chair of the ACOI Infectious Diseases Subspecialty Section. Along with the leadership of the ACOI, we want to thank you for all that you're doing as we face this unprecedented time in medicine fighting the COVID-19 virus. Moving forward, and in conjunction with the ACOI, we want to share with you some information as it becomes available, as well as some other bright spots that we are seeing so that we can all feel some hope in these trying times. First, we're going to start with an update, and I want to start with a quick update, as promised, on the controversial COVID-19 treatment that I mentioned last week. You'll remember that I was concerned about the hype around the drug hydroxychloroquine. My fear was that it was being prematurely advocated as a hopeful potential medication to battle the COVID-19 virus. So interesting developments on two fronts have surfaced that I wanted to take a moment to point out. First, the International Society of Antimicrobial Chemotherapy has just announced that disputed French trial did not meet the organization's standards, and they're not the only ones criticizing it. There's been some serious concerns raised from others in the fields about the confusing data, conflicted peer review, and quite, frankly, questions on ethics involving the study. So I've included these articles about this in the reference below for you to read more about if you're interested. But secondly, there was an interesting development that comes from Brazil, and the country went as far to actually stop their research trial on hydroxychloroquine for safety reasons after a coronavirus patient developed a heart arrhythmia. And of course, as we know, the combination of hydroxychloroquine with azithromycin will prolong the QT interval, which will, of course, lead to a greater likelihood of developing arrhythmias. Quite frankly, even a heart block altogether. So there's certainly more that will surface on this, and I will continue to watch the U.S. trials and certainly keep you posted. In terms of our clinical updates, I really wanted to kind of talk about some of the things that Dr. Fauci this past weekend had talked about. And of course, I want to give a huge shout out to Dr. Fauci as we've been watching him and the amazing work that he's been doing during this pandemic. A New Yorker magazine article published last week dubbed Dr. Fauci America's doctor. This guy has demonstrated a lot of stamina lately. He's nearly 80 years old, and he's running the National Institute of Allergy and Infectious Diseases for 36 years. He's seen himself advise 6 presidential administrations, and he's witnessed a long list of viral epidemics, including, of course, HIV, SARS, avian influenza, swine flu, Zika, Ebola, and, of course, now the SARS-CoV-2 virus, also known as COVID-19. His updates, as you know, are very matter-of-fact. He admits when policies or approaches have failed, and it's tough to be in front of those cameras daily. Yet he's on the front lines in a different way than our other medical professionals in hospitals and clinics, and yet it must be very stressful. Those of us in infectious diseases and elsewhere in the medical community appreciate his science-based approach. And honestly, this is a war that we frankly don't know how long we'll be battling. And again, this past weekend, he suggested that hundreds of thousands or even millions of silent carriers may be unknowingly transmitting the coronavirus across the United States, all because they don't realize that they are infected. And I just want to say that silent carriers, those were his words. He admitted he's still guessing at this point, but that 50% of total infections may be presenting completely asymptomatically. Other countries have been witnessing the same thing, and last week we talked about Iceland, recognizing that 50% of those that tested positive in the country of Iceland were asymptomatic. But he said that the actual percentage of those who are asymptomatic can't be confirmed until, of course, we do serosurveillance studies or the antibody tests that we've been hearing a lot about recently. So that's why it's important to remain in our social distancing mindset, and why Americans need to heed the advice to wear masks. Asymptomatic carriers or even pre-symptomatic carriers infecting others could be much more of a factor for disease transmission than anyone otherwise originally believed. And I want to say that here in New Orleans, I have been seeing more and more people taking that advice and wearing face coverings. So it seems that America is listening. So thank you, Dr. Fauci. And I want to say one more thing. Dr. Fauci, making infectious diseases doctors cool again. Last thing, as a takeaway for the week, we talk clinically and we get caught up and we miss the human stories that are out there right now. So this is one that I'm going to summarize for you, and this one really got to me. So this is a heart-wrenching and poignant story that I wanted to point out, and it's about Buddy Baker's parents, who both died on March 29th of COVID-19. Buddy is an NFL agent, and he's using his status to make sure that people know how serious and how real this pandemic is, and to him, as well as to others who are losing loved ones. So his parents were in their 70s, and they started displaying symptoms in early March. Their battle didn't seem very serious at first. They didn't feel very well. They went to the doctor. They were sent home. And then when their symptoms did improve, their doctor recommended going to the hospital. They went to the hospital, and they were sent home and told that they need to self-quarantine. After more days of not improving, they returned to the hospital where his dad then stayed and was admitted. Eventually, his condition deteriorated, and then his mom was admitted soon afterwards after she tested positive and was noted to be hypoxic on room air. Eventually, they were both moved to the same room and into hospice care, and they died within minutes of one another, next to each other. And it should be noted that they were married 51 years. But he's getting this story out there because he wants people to be motivated to do the right thing. He says he's calling on people to listen to what health officials are saying, practice social distancing, wash their hands regularly, and most importantly, stay at home and wear a face mask or covering when you're out and about. I couldn't agree more with Buddy. My heart goes out to him, his family, as well as all of those who are suffering firsthand from this pandemic. So in conclusion, I just want us to stay, I want y'all to stay on the lookout for our regular updates, and to read more from the sources used in this report. Please go to acoi.org/COVID-19. Together with the ACOI, we will help you have the latest information to help you respond to your patients and stay on top of this crisis. And of course, please feel free to reach out to me anytime at madery@mac.com. Please stay safe. We can do this together.